This is Merlyn Vogt, and he's here to talk about his experience with type 2 diabetes.
Do you have a family history of type 2 diabetes?
No, surprisingly, we have no type 2 diabetes in the family except for me. And it's one of the questions that the doctors do ask you when you go in if they're suspicious of diabetes is what the history of the family is, but we have none in our family.
When were you diagnosed with type 2 diabetes?
I'd say about 10 years ago I got diagnosed.
When did you first notice that you had symptoms of type 2 diabetes, and what symptoms have you experienced?
About 11 years ago I experienced things like bad circulation in the hands, bad circulation in the feet. So, and I was also, the other symptom I had was that I was losing lots of weight. But I kind of thought that because I was drinking quite a bit more water than I usually did, that's where I was getting the weight loss from. So when I went to the doctor and he asked me these questions about what was happening, I told him about the weight loss. He had actually noticed the weight loss because I hadn't seen him for about a year, and he had asked me why I had lost so much weight. And I said because I was drinking quite a bit more water than I usually did. So then he was right away suspicious about something. He said he wanted to take my blood sugars, and he did it right there in the office. And at that time, my blood sugar was at 23.5 or something like that. So it was pretty high. And he said right away that they had to put me on some medication for it.
What medication did your doctor prescribe for you, and how have they affected you?
They haven't affected me. What I'm on is, what I got put on at first was something called Octos, and the other one was metformin. And I've had really no real side effects from it.
If you've forgotten to take your medication, has it caused any problems for you?
I have forgotten once in a while. For instance, if we go away for the weekend, if I also forget my medication, I've gone a whole weekend without it, and I haven't really noticed anything that affects me if I forget it. The only thing that I need to do then is stay active and make sure that I get around a golf in or something like that.
Have you ever had to switch medications due to them not working for you?
As a matter of fact, about a month ago I went to the doctor and my blood sugars have been creeping up, and he asked me or he told me that he was going to put me on a different medication. So he's done that, but we haven't done an A1C count, and that's where I take a vial of blood every 3 months, and they get a very accurate reading of what my blood sugars are doing. So the next time I go see him, we're going to figure out whether that's helped a lot or not, or helped at all.
Have you experienced any negative side effects due to these medications?
No. It's like I said, the side effects haven't really affected me. The only thing that I sometimes, and it's not because of the medication, I don't think it's because my blood sugars go up, is I get a tingly feeling in my back, and also my feet, they get numb. That's the only effects that I get from it.
How often are you required to take insulin through pills or needles?
Or has this not really been an issue for you?
Well, I don't take any insulin. I just take oral medication, and I take metformin and this new drug. And the metformin, I take it in the morning with a meal, and I take metformin with another drug in the evenings, and I also take ASA with that also.
How often do you test your blood sugar?
Should be doing it a couple times a day, and I maybe do it a couple times a week. It's not. I should do it more often than I do.
What has been the most inconvenient part of having this disease?
Well, for me, it's right now, because I'm not doing insulin, it would still have to be more remembering to take your medication and stuff like that. That's really the only inconvenience that I have with it, because you have to remember you should remember to take your medication at all times.
What dietary changes have you made since your diagnosis?
Not a whole lot. I try to watch how much sugars I take in. I know that they want you to cut down on the pastas because everything that you eat turns into sugar. So you have to be careful, and especially with the high gluten diets, then all those pastas and that they tend to turn to sugar. So you want to stay away from bread products and stuff like that.
Has this disease affected your family in any way?
Well, I should ask you that. No, well, I don't know if it has. I sometimes think I am a little bit moodier than I have been in the past, and I think that probably contributes to the diabetes. And so, yeah, it's just one of the side effects that we have. It probably affects family life to a certain point.
Has this disease caused any other medical problems for you?
Well, not as of now. I know that my eyesight isn't what it used to be, but then it's like I was telling my daughter earlier that most 50-year-old men have problems with their eyes, so I don't think it's just a thing that is affecting me because of diabetes. I just think it's an age thing. But I think in the future that if my sugars keep where they are, then I might have problems later on.
All right, well, thank you for talking with us.
You're welcome.